It is absolutely possible to help women recover from very severe depression, and that's exactly what our unit is there for. What's important is that someone can get to a facility like a mother and baby unit quickly before their mental health deteriorates in the community and something dreadful happens, for example, either suicide or infanticide. You know, those are the extreme ends of risk. But in terms of recovery, women that come to our unit do extremely well. It's very rare that people don't recover from even the most severe of depressions. And therefore the prognosis is really very good for women if they have the opportunity to come to a unit like the mother and baby unit. One of the things people don't do is actually seek help early because they're terrified of things like stigma, you know, the general stigma of being mentally unwell, of being depressed. They're frightened, certainly in this climate now, of things like, you know, social services being involved in, you know, admitting they're depressed or, you know, not feeling well might involve social services and potentially a baby being removed. So they panic about what it might mean to seek help. There might be domestic violence involved, for example, so people are frightened for those reasons. But we always say, please come forward early. And that's why the screening processes antenatally, we work very closely with the midwives in each of the hospitals, so that if they recognise somebody is unwell or has a history, they will automatically refer on to our service. So the symptoms that we talk about, it isn't just feeling a little bit tearful because someone's, you know, a little bit emotional because they're pregnant or just had a baby. It's a little bit, it's more than that. It's feeling really quite miserable, really quite low in mood and quite down. And in some cases, it might be that they can identify a trigger. It might be sometimes, or quite often actually, people don't really know what the cause is. They can't quite put their finger on what the cause is. But certainly what they feel is miserable, they're quite low. That feeling of being low in mood is sustained over several weeks. And it's not just a day or two or an afternoon, it's several weeks of feeling very miserable, very low. It starts to affect their eating. Perhaps they start to lose weight, and think in pregnancy you should be putting weight on, not reducing weight. Might be they're not sleeping properly. Might be that they're anxious and they're ruminating. Might be that they're terrified of having the baby, or they're worried about how they're going to cope. They might start having thoughts about, just unnecessarily being worried about the baby's health, for example. And I suppose at the extreme end, once things get severe, they might start thinking about self-harming thoughts or even harming the baby. Tiny thoughts that just flit into somebody's mind. And if those sorts of things happen, then you know that actually you're dealing with something quite serious. If a partner or a family member is worried and thinks, well, actually my other half isn't quite right, or they're not behaving in quite the right way, it might be that they think they're more irritable, actually, which is, again, a very hard thing, because irritability is quite normal when you're pregnant, and it's quite normal when you've just had a baby, because people are very tired. But if they do suspect something more, again, I would advise that they go and seek help. If there's a midwife involved, to speak to the midwife. If there's a health visitor involved, to speak to the health visitor. Go to the GP, for example. Actually, in the UK, we're very lucky. We've got a very good primary care system around pregnancy and afterwards. So there are those core professionals to go to as a first point of call.